my name is Michelle and I'm a chiropractor. Today I'm here to introduce to you guys what happens in a chiropractic session. There are a lot to do. Hi, my name is Michelle and I'm a chiropractor. Today I'm here to introduce to you guys what happens in a chiropractic session. There are a lot to do during the first visit. Upon patient's arrival, vital signs such as blood pressure, weight, height, and consent are taken. Next, during history taking, multiple questions regarding of the complaint will be asked. Besides, patient's psychosocial history, family history, and system reviews will be asked too. This is to gauge patients' general health and active daily living that may relate to the problem. After history taking, a detailed physical examination will be carried out, which consists of postural assessment, range of motion, static and motion palpation, neurological assessment, and orthopedic tests. These steps are there to help chiropractors to spot the anatomical structures that are responsible for patients' complaint. After physical examination, further imaging such as X-ray, MRI, or blood tests may be ordered. Once everything is done, an explanation of patient's complaint is given together with patient's prognosis and a detailed treatment plan. The treatment plan may consist of a few elements. For example, chiropractic adjustment, modalities such as ultrasound and shockwave therapy, home exercises, nutritional advice, and soft tissue therapy.
Hi! Alright, hi everyone. Thanks for tuning into our Association of Chiropractic Malaysia World Spine Day webinar series. I'm Dr. Zamin and I will be your moderator for today. Just a quick introduction to our audiences that are here. World Spine Day is celebrated annually on the 16th of October, highlighting the burden of spinal pain and disability around the world. And this year's theme is back-to-back, reflecting the need to reset and refocus on our spinal pain and disabilities at home, our workplace, and the schools. Don't forget to join our events to know more about the human bodies, to learn the proper ways to take care of it, and to move for a better and healthier body. If you would like to take charge and start challenging to become active, this is the best chance to do it since you're already here. Just head over to our Facebook page or our Instagram page to know more details, and also drop us a message if you have any questions, and join our virtual challenge to stand a chance to win prizes like a Fitbit and an EMS pain therapy device, and so many more. Without further ado, let's welcome our speakers for today. First off, graduated with a first class from the IMU, originally practicing in KL, but has now moved to Penang Island to continue his practice. And what is worth mentioning is that he is also our Vice President of the Sports Chiropractic Council of Malaysia. And let's welcome Dr. Samuel. Hi!
Hi, everyone.
Hi, how are you?
I'm good. Good to be here. Hi,
Yeah, good
I'm
to
Dr.
see you
Samuel.
too.
Yeah.
Yeah,
Thank you
let
for
us
such a lovely interview,
Yeah.
introduction.
Sure. Let us know more about yourself. You can introduce yourself first before we move on.
All right. Hi, I'm Dr. Samuel, coming to you from Tex Penang Spine and Joint Specialist. For the past 4 years, I've been practicing, keeping my Penang lungs strong, well-informed, healthy, and pain-free. Like mentioned by Zimin, I am serving as a Vice President of SCCM, which is the Sport Chiropractic Council Malaysia, since the beginning of this year. I love the sport ultimate frisbee since uni days. That's how I met Zimi, and lately rolling in BJJ as well. It's pretty sweet to actually able to put my chiropractic degree and combine it with sports and treating the athletes now. And now we're here with my fellow colleagues, sharing a topic that I'm really passionate about. It's good to be here, and thank you for having me.
All right, nice. All right, next up we have Dr. Ian. So Dr. Ian personally is also my friend. Okay, so he is currently a mobile chiropractor, and I know him personally. He's a very, very dedicated and always putting his best for his patients. So I will now introduce Dr. Ian.
Hi, everybody.
Hi, how are you doing?
Doing okay. A bit
All right,
excited
that's
for this
nice.
event. So I'm going to reintroduce myself. Thank you so much, Dr. Sumin. I'm Dr. Ian. I'm a mobile chiropractor who loves treating athletes. I'm more known to be the mobile chiropractor or nomad chiro. So meaning I go to people's houses or offices for consults or treatment. I don't do much of a. I'm not much of a team sport kind of person. More of a yoga or weight training kind of person. So yeah, I'm more well off. Yeah, doing those kind of sports. So thank you.
It's okay. Those are also sports. I also don't know how you do yoga one.
Yeah, back to you, our moderator, Dr. Zumin.
Okay, all right. So we will start our talk right now. So just give me a second. All right. So what is sports chiropractic? We will just let Dr. Sam and Dr. Ian take the floor.
All right, so today we're going to be talking about sports chiropractic, and we're going to spend a bit of time talking about this cause this is obviously the main topic of the day lah. So, but before we proceed, I just want to put out the purpose of this talk today, which is how a sports chiropractor can help you train safely and effectively. Number two is how you, as the audience, are able to identify potential issues or blocks in your fitness or athletic journey, especially when it comes to overloading injuries and reduction of injury risk. And of course, some general advice for those who are tuning in this evening. So without further ado, what is sports chiropractic? Right? It is a specialty of chiropractic recognized as a subset of chiropractic that is dedicated to treating the athletes. We include things like injury prevention, improving your function, and contributing to the enhancement of your sport performance. To put simply, sports chiro are experts in diagnosis and treatment of injuries related to sports and athletic performance. So I'll pass the floor to Dr. Samuel to talk about sports chiropractic and what it means to him.
All right. Thanks, Dr. Ian. Just treat us as normal chiropractors, but we specialize in sports. Basically, sport chiropractor is basically that. We would tend to focus on preventing injury. I'd like to elaborate on that. Any chiro can actually choose this path, so long they have the proper education and the proper paperwork. It is also option that they can actually enhance, further develop their skill in dry needling, taping, and even some soft tissue therapy. But all in all, we as sport chiros, we really want to take care of our athletes. We want to make sure, and yet in even the SCCM, we want to make sure all athletes get a chance to have experience chiropractic care through the sport chiro community. And yeah, this is our topic for today, to be honest.
Right. So, well, I don't do much of the modalities that you do, Dr. Samuel, but we both share a common expertise in injury prevention and rehab, right? As we develop our treatment plans for our athletes to return to the sport as soon as possible, right? If there's one thing an athlete cares about is his ability to return to play, or RTP, safely and optimally. As chiropractors, who treat mostly athletes, competing or non-competing, both Dr. Samuel and I work with people who participate in a variety of sports and physical activities. To name a few, we got futsal, tennis, golf, basketball, running, track and field, yoga, my favorite, rock climbing, or the more recent one, gaining more popularity recently is spin classes, right? So sports chiropractic is care isn't just for athletes who've been injured. The type of therapy we do can help athletes to avoid or more so reduce the risk of injuries while also improving function and mobility. So the next slide, please. Where the part where is there a difference between a sports chiropractor versus your usual normal chiropractors? Right? So yes, of course, right? That's why we're here, right? So a good doctor or chiropractic is equipped enough to treat most things, but there are many branches of chiropractic. For example, neurology. Some treat kids, some treat animals. We all learn chiropractic adjustments in chiropractic school, but rather than just an adjustments, which by the way helps a lot in relieving a lot of these symptoms, a sports chiropractor can offer a more complete plan of action that is tailored to the individual athlete and their problematic areas, or even habits that can probably be problematic if not started out early in their career. So the plan can often include some form of resistance training and some corrective exercises that can improve their coordination and muscle tone of the athlete, right? So, Dr. Samuel, I'd like you to share your thoughts on this as well.
I think I can fully summarize what you're saying. It's important to know, and as an athlete, right, why would you like to be adjusted, especially by a sport chiro? And it's why it's important to go to someone who has some experience in sports, especially in sports chiropractic, because we are trained to treat athletes both on and off field and during a competition as well, even in pre and post season. So not just pushing the spine and go pop, but actually do the things like you say, resistance training for their specific sport and activity, so that we give the athlete an edge and an advantage that we're going to talk about soon.
Yes. So put it this way: if you have a car issue, you go to a mechanic. If you have a pediatric issue, you go to a pediatrician, right? You don't take your baby to the vet, right? Go animal doctor. Doesn't make any sense, right? So if you are an athlete with whatever problem it is, insert problem over here, you see a sports chiropractor. If you're an athlete or someone who is active, we can help you ensure that you are doing all you can to get back to your sport or your field as soon and as quickly as possible. So the next slide. So what
I think at this,
constitutes an
yeah,
athlete, right? Oh, sorry.
yeah.
Yes, Dr. Zimi.
All right.
Yes, this part. What constitutes an athlete, right? Dr. Sami, would you like to say? Were you about to say something just now?
No, no, no. I was like, I mean, I'm sure at this point everyone is like, am I an athlete? Yeah. So like what constitutes to be an athlete? So maybe you can talk more about this.
Oh yes, definitely. So, reading the slides over here, must I be an athlete to see a sports chiro? Number two is, do I need to be competing for a sport to be an athlete? Okay, to be a bit more inclusive for today's talk, we're going to say that an athlete is someone who is actively trying to improve their performance, right? But for us normal athletes, we are actively trying to improve our health through being athletic or active instead. So, must I be an athlete to see a chiro who specializes in sports? The short answer is no, right? Dr. Samuel, you got any inputs on this section? What do you think?
Yeah, I think the sport relative to the athlete, right? Even the definition of sport has seen some welcoming changes. Like we're talking about esports, people who sit and they play games on the computer. Yes, I view them as athlete as well because they have to perform. Even dancers and at some point musicians who are really passionate in their craft, they are considered athlete to me as well because they're not working in general big muscles, but tiny, small little muscles in their forearm, which can develop injuries as well. So yes, um, no matter what your experiences is or whatever it's whatever sport it is, I believe that everyone at certain level, if you're active, you are considered as athlete as well. Maybe you're not an elite athlete that you're competing in Olympics, but you're an athlete nonetheless.
All right. So no matter what your experience levels, everyone in some ways is an athlete, right? All
That's
right, I'm
right.
going to pass the floor back to Dr. Samuel as we move on to the next slide. Common sports injuries among athletes, right?
Right. So, as an athlete, right, or any active individual, there are some injuries you really like to keep a lookout for. Uh, I'll just break it down to three. The first one will be overloading, that we're going to dive deep very soon. So, overloading injuries, a lot of them comes from pains and discomfort due to abnormal loading. Maybe it's too fast, too soon to a specific exercise or specific movement. The other injuries that we would like to see also, we would like not to see, is head injuries that we need to rule out first. Concussion is one of them. And of course, we want to rule out fractures as well. So let's dive deep into overloading injuries. So, like I said, the mechanism of injury is too fast, too soon, right? These are the common names as well. What are the injuries such as, if it's in the knee, it's an ankle, it can be a ligamentous sprain. If it's a hamstring injury or any part of the shoulder muscle, we're going to call it strain. If it's a low back pain, normally it comes from a discal injury. And there are other pain generating parts such as dyskinesis, meaning that poor movement patterns or the movement patterns are wrong, or they're tracking wrongly, or minor or major traumas. These are all considered as overloading injuries. Have you seen athletes like this struggling before, Dr. Ian? I bet you've seen it before, yeah?
Oh, yes, definitely. A lot too many lah. Right. No matter what sport you're in, right, your athletic performance is dependent on both your mental and your physical fitness as an athlete. So if you're into rigorous games like futsal, basketball, or powerlifting, you must pay extra attention to your fitness, given that this training and on-field experience can take a toll on your body. Another example of overloading injuries is there's a tendency for guys who just started weightlifting to only train their upper body, right? Particularly their chest area or their pecs. Or even those who are experienced lifters, they have the tendency to I have no idea why, but they have this tendency to do that, right? And when
They
that
might like
happens,
the chest.
yeah, no idea why they get this like invisible chest
For
syndrome, you know.
aesthetics, yeah.
So when this happens, right, it can cause some form of like muscular imbalance, right? That can give rise to a lot of limitations when it comes to their sport, right? If you're looking, for example, right, if you're looking to increase your overall performance in the gym, we all know that muscles should be trained as full range as possible to adequately stimulate the growth of that particular muscle. Moreover, training in a more balanced manner can improve your joint health as our body follows this rule of use it or lose it, right? For the development of our bones, muscles, ligaments, and just about anything in the body, right? So train well or apply or use it or lose it rule when training, all right? So we're moving on to the overloading injury section. Um, yeah, Dr. Samuel, please.
Yeah.
Yes.
So I'd like to add on by saying, for athletes right nowadays, because MCO is opening up, most of them who work from home might be struggling from their long hours of bad posture, which also can have tightening of the pecs effect. And if they go back into their sport in that poor posture or the muscular imbalance, right, they will not translate well into the field, and that's where potential injuries can happen. Hence the word overloading. As sport chiros, we're trained to pick that up, and more so over. I would like to add on the use it or lose it rule. It's called the Wolff's Law. I know
Yes.
this is a first class problem. We like to name things, but at the end of the day, yeah, we want to know what is the things that keep them off field. So we're going to remove that and maintain pain free movement, like you said, during on field uh, or sports, which
I
I
think
agree
that
totally.
is, yeah, I think that is like super important, especially people out there who really don't know what to do. Like they just dive straight into the hardest things, which is very commonly, it's very, very common within our practices also. And yeah, it's very easily injured as well for those kind of problems.
Yes, definitely. Hey, to add on a little bit, right? Just now you mentioned too fast, too soon, right? I like to
Yeah,
add on another one is too stagnant for too long kind of thing. So
yeah,
that's what I
That's
find.
me.
Hey, no lah, no like that
that's
lah.
everyone.
That's everyone during the
That's
MCO,
everyone.
right? So we
Exactly.
got a question. Gym closed for 4 months. How can I trim back to my previous state? Dr. Sam, would you like to answer this question?
Yes, I would love to answer that. For people who, for example, have some certain program that have stopped due to the inaccessibility of a gym. For example, they have a PR, they have hit like maybe they can squat 120 kilograms, right? And then after 4 months later, the gym starts back, and the most common thing is you see patients or athletes try to lift the same weight and they hurt themselves again because the muscle went through a bit of tightening or atrophy, so they don't feel as strong. So what is the proper way of what advice do we give to this sense? Normally, we would say that if you take 4 months, you take 4 months. If you take 4 months, around half of that 2 months, you take 2 months to actually go back to wherever you came from, if that makes sense. So if you're lifting 120 before and you went through a hiatus, like not hiatus, but you didn't practice or you didn't squat for 4 months, it'll take you 2 months, half of the time that you didn't practice, to go back. So it's best that you start at 60. I know it sounds sad and it's like, oh man, but that we have to address the ego part of the lifting. So you're lifting for long, not for a short period of a part of your life actually. You want to live until when you're maybe 80, 90. You want to make sure this is a long-term thing. So to go long, you have to put your egos outside of the gym, and then you have to lift 60 first if you're hitting
Right.
120, and then just slowly build yourself self back up. There's a 5-5 rule. There's a lot of other accessory muscles that you have to train in order to go back, because those are the first one that disappears first. when you don't train. What can ease that off? And with this, what can ease that off is that during the 4 months, right, do something, right? Yeah, you might not able to have an access to a barbell if you're not as rich. People who can purchase their home personal home gym. You can definitely get a cheaper alternative. Like 1 liter of water is actually 1 kilograms, so you can actually lift like bottle of waters at home. Make it challenging, make it interesting, and for sure bodyweight exercises, which I believe Dr. Ian is expert in. You
All
can
right.
really put into calisthenics into good use when it comes to comes to weight training, some variety. But yes, that would be my answer.
All right. I think to add on a little bit, right? I think the same rule still applies, lah. Whatever measure you plan to start with or go with, the too fast, too soon rule or too stagnant for too long, uh, yeah, you just got to go with that. So, for example, like Dr. Sam said, if you're not used to it, then don't go all the way, lah. It's been like 4 months, right? So, yeah, better to tone it down. And when you can, you slowly up it again, week by week. There's so many programs out there for this kind of thing. So, anyway, if you're watching this talk right now, please do let us know if you have any questions by moving those fingers of yours at the comment section, right?
Perfect.
All
Okay.
right, we have another question. How do I know my muscle ache is due to overfiring or underfiring? Anyone wants to take this?
Dr. Ian, or I'll go.
Go
When
ahead.
you say when you say underfiring, overfiring, what do you mean by that? Meaning that you can't feel your muscle when you're under fire? Is that what it means?
I'm not too sure as well. Overfiring or underfiring. Tell you what,
Because
Meaning, I think what he's trying to say is maybe overfiring, meaning is it overused, underfiring, or is it too stagnant for too long, like what Ian said just now?
you
I
take this,
think
Dr.
I'm
Ian?
assuming. I know.
No, that's
I'm
a good.
assuming.
That's good. That's good. So when it comes to overfiring, maybe it means like called DOMS, delayed muscle onset soreness. Soreness. So people who train really hard, say they lift like the new PR, the personal record, right, and they feel very sore the next 2 days. It shouldn't be, the person shouldn't feel sore past 2 days. Let's just put it this way: with proper recovery, with proper sleep, proper hydration, proper nutrition, they should recover within 2 days. But if it carries along, say, 1 week, and the soreness never went away, or it actually
right,
evolves into pain, we are looking towards like a proper strain, or maybe we have to look into what is the degree of the strain, or maybe sprain. So that one, if it's under firing and you're feeling sore, most likely it's because you're tight, like you're not been using the muscle, so it doesn't have a chance to actually lengthen and contract properly. So that one, most likely if you're sore, you got to work on mobility a bit more rather than just seeing whether you're working too hard. Work on mobility and dynamic stabilization first. I know this is very janky terms, but at the end of the day, if you're not stable, you're not going to lift weights, you're not going to perform properly. Like shoulders and hip joints, the ball and sockets are very unstable. You have to look into the front, back, the side to side muscles, whether they're activated or not. So we're not talking about sprains, we're talking about just muscles. So yeah. Dr.
All
Ian?
right.
I think there's like another way to look at the question, I guess. Maybe the question is asked because this person is not sure if they're on track or not, if it's too much or too little that they're doing. So I think the same rule still applies. You got to try it out and see how it goes. If it's too painful, abnormally painful, right, we got to tone down the intensity or the frequency a little bit, give your body a little bit time to rest. If you're not sure how, please see someone, a physio, chiro, right? We got chiro, sports chiros over here. So see
Sports
us.
Cairo. Yeah.
So uh, so just take it, pace it out. Like I said, if you never run before, don't go running immediately, right? How about you start with a walk first and then brisk walking and then running, slowly, take it easy. There are many instances where, like I said, too fast, too soon. Never played badminton for 6 months. A patient of mine never played badminton for 6 months. Decided to play 3 times a week right after the lift of MCO, right? And got like a really, really bad sprain that he couldn't walk. So
Yeah.
those are possibilities, but I'm not saying that you're going to be like that, but just take it easy, guys. Take it easy. All right.
Look out for them. Yeah.
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 We move on to our next slide. Conditions we can
Yep.
help with.
All
So,
right.
Sam, you can cover this. Thank you.
Can. So as sport chiros, we need to actually find out what is the tissue that's generating the pain. So not just the history, the science, but also look into performances as well. Because sport chiro must evaluate the state of the athlete as a whole. You can't, because most of them sometimes come without pain, and they say they want to do something stronger, faster, and you want to accommodate that, but at the same time not at the risk of their health, their their spinal stability, whatnot. So we're going to look at them as a whole. And when I say as a whole, I mean it like not just physical as well. We need to look into the mental health, which is a big talk this year and last year, especially during COVID. If the patient has or the athlete has some form of anxiety or depression, we have to check it out, co-manage with a psychologist maybe, and just work it with them. We need to also point out that if they're overtraining, if they're doing too much quantity, like you said, rather than focusing on quality. So yes, we want to help in all these facets in terms of an athlete.
Mm-hmm. Mm-hmm. All right.
Oh, yes.
Yeah, Ian, you can take away, man.
All right. Oh, okay. Okay. So back to slide 9. All right. I would like to add to Dr. Sam's. All right. There is this part where it says frequent re-injuries. Right.
Yeah.
I got a case where, speaking of this, right. What I find most common in like my practice is with the athletes, especially the futsalers and the footballers. Right. Yes, I know some of you are here tonight. So, particularly this group of people who had previous injuries or, for example, sprains or strains in their ankle, they tend to re-injure themselves after the first time of getting the first injury, and they think that it's normal to be re-injuring your ankles again, 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 again. So what happens more often than not is when proper rehabilitative techniques are not applied, is that they also feel that their legs are not the same anymore. Their legs are not the same anymore as before or as pre-injury. This could lead to their performance as an athlete or even as an individual who might notice, number one, is that they miss the step more often. And two is that they have no confidence when they are going like downstairs, or they feel like their legs are not grounded, right? Or number three, even going down from a hike, they feel like their legs are about to fall off. So these things can be sorted out with proper guidance from a clinician who's trained in rehab techniques, which is not going to, number one, not only going to reduce your risk of re-injuring your ankles or your legs, but also going to improve your confidence in yourself when you're walking. Imagine all the confidence you'll get when your legs are firmly on the ground, grounded when you walk, when you run, when you approach that business deal. Yes, I'm getting very carried away right now, but the point is look for a sports chiro near you so that you can start living your life with more self-confidence, right? If you
Oh
like
my
that,
God.
in
Yeah.
the chat box.
I'll add this also. It's
Right.
good for in the beginning, right? Even I think Dr. Ian also can agree with this. Most of our athletes that we first see, right, just comes for injury, so they have pain and discomfort. Most probably like the low back, or sport-related injury like the knee, the neck
Oh, yes.
pain, the wrist injuries, which normally is pretty. It's a pretty quick process for the pain to go away when the treatment is properly given. Now the athletes choose to come back right to their chiropractic care without pain. Uh, it is good to know that the athletes feel a certain confidence, like you said, and they feel comfortable in being able to go 100% from for
Yes.
and ask for the body to go while performing their sports, whether it be in the competition or even in training. So that's pretty cool. Yeah.
Mm-hmm. Yeah, I think I can relate a lot to this over spraining, over injury, especially in my after I sprained my ankle not one, not two, but 3 times
Good job. Yeah, good.
What sport were you playing?
simultaneously. I don't know. I just walked and I just like once it was just crossing a road. Once it was just playing futsal. The ones is that are more serious is the futsal one, and I got my leg, like my ankle, swollen for like 2 weeks straight. Yeah, and afterwards, I really felt like really not very confident to walk on uneven grounds, especially when you go to hike and things like that.
I
Yeah,
think I'll
I
echo one of the professors in IMU said this before. He said that there's only three things that's absolute in this world. The Earth is spherical. the sky is blue, and people who play futsal will have some form of ligamentous injury. The only two reasons why is because that the court is so small, they have to pivot so much, their knees and ankles can't handle it. And the other one is
Yes.
because the ground is so hard, so those are not really ankle and knee friendly.
Yeah,
So for the futsalers out there, please be careful. All
Yeah,
right.
we please
Yeah.
try to reduce your risk. Do what you can to reduce the risk of injuring
Yeah.
yourself.
Yeah.
If you need
Mm-hmm.
help, like I said, we're here, right?
Yes.
So,
Mm-hmm.
we're
Yeah.
moving.
Anyways,
Yeah.
anyways, remember if you have any questions, just leave it down in the comments below and we'll try our best to answer them. And also for those who just came in, we're talking about athlete injuries or athlete spinal health. So if you know anyone who needs the information, you can just tag them in or share this video so that they get to see what we're talking about as well. All right, so moving on to the next thing, we're going to talk a bit about benefits of chiropractic. Sports chiropractic, yeah.
All right. If it isn't already enough, we're gonna talk about more about benefits of sports chiropractic to athletes for athletes, right? So if you don't already know, chiropractic care is the natural healthcare option that provides a drug-free, non-surgical treatment for a variety of musculoskeletal conditions, ranging from low back pain to shoulder injuries, or even the stub toe, right? And also the diagnosis of concussions and other traumatic brain injuries, right? Athletes in particular can reap the benefits from sports chiropractic care, as most of these professional sports organizations, to name a few, NFL, MLB, UFC, provides chiropractic care to their athletes as part of their overall wellness program. So what are the benefits of sports chiropractic care? Here's a few for athletes directly. Number one, is improving their athletic performance and improving their range of motion during uh, and range of motion and performance during competition, right? During an athletic competition or training, an athlete might experience some form of joint stiffness and reduced movement due to whatever they're experiencing during the event day, and this can have a very negative effect on their performance during the event, right? Or during training, that can affect their efficiency. So what we can do is provide an adjustment during the game that improves the movement of these joints. It's sort of like a reset button, which can improve our athletes' joint function and performance during the day by reducing the stiffness in their joints. I think we have more details coming up from Dr. Samuel about some events happening real soon in the very near future. Would you like to update us on the Sports Chiropractic Council of Malaysia, Dr. Sam?
I'm very proud to announce that end of this month and beginning of next month, actually, SRAM or SRAM, or we call it the Squash Racket Association of Malaysia 2021, is treating. We're going to treat their international players and our local heroes as well in the Malaysian Open, Asian Team Championship, and the Men's World Championship as well. So do catch us there if you do hang by at the Bukit Jalil. Dr.
Yeah,
Ian?
Dr. Samuel, I think
Yeah.
you can promote this more, especially
Yep.
for our chiropractic colleagues out there that are interested but don't know where to start in sports chiropractic. Definitely you can look for Dr. Samuel. Anyways, we have a few questions coming in. So one is, both of my knees has been creating a lot of noises whenever I'm doing squat. Is it something that I need to be concerned about?
It depends on what kind of sound it's making, lah. But if it doesn't give you much of pain, then it's likely just some tendons gliding, just like when we do this. You hear some of these tendons gliding over some of these grooves over here. Shouldn't be too bad. But if it does give you pain, then I suggest that you look for someone who's able to diagnose and figure out what's going on, lah. Right?
Yep.
Dr. Sam, any
Yeah.
input?
The question
I'll just
is a bit
elaborate on that
vague,
also.
right?
No, it's not vague. It's actually very common to hear. There are many sounds. We'll try to classify the sounds into like popping, clicking,
Yeah.
snapping, grinding. So if you're talking about just snapping, like when you bend over, like when you squat, like what Ian said, it doesn't hurt. Take a look at whether you're in the right movement pattern. That's for sure. Like knowing that the knee is a hinge joint, right? You better hinge and not go into like caving or We call it genu valgum and genu varus. So you don't want them to cave in or cave outwards. You want them to glide on top of the second toe of your feet in that direction, in that plane of movement. You also want to make sure that your hips are not restricted, because the hip being the ball and socket joint, it can move a lot. So if there's restriction in the hip, guess who has to take over the movement? You never open a door like this, right? So the hinge joint can actually get hurt a lot, compensating for the hip. So you don't want to get that clicking sound or the snapping sound, because like you said, not moving in full range of motion or not using the right muscle. Again, I'll echo what Dr. Ian said. If it hurts, if it's bothering you, if you find out you can't squat because of it's due to the clicking sound, please consult your local sport chiro as soon as possible. We will find out and get to the root of the problem.
Okay,
Yes.
that's great. Okay, the next question: when a recreational athlete injure themselves for sports, for example, acute sprains, okay, how long would you advise for them to refrain themselves from the sport itself?
Dr. Ian?
This one is a tricky question.
Oh yes, I agree.
I would, depending on how bad it is, right? If you really strained yourself, grade one, grade two, I think it's still not too bad. Sometimes, but you know what? Depends. Really depends. You have to see the person, to see whether they are fit to play, return to play. There are many criteria to that. There shouldn't be any swelling when you play. Um, yeah, but most importantly, if it's strain, we want to make sure that it's just a strain, not anything else. If it's something else, uh, then you probably gotta refrain yourself from playing the sport for quite some time. But if it's just a strain, we try to move it as soon as we can. Again, we need to start to load the joint, load the muscle so that it adapts and it grows to that stress, rather than just hold it for not do anything about it for a long period of time, and that will lead to a lot of other negative stuff, such as atrophying of the muscles, the joint doesn't move so well, that kind of thing, right?
I agree. Just to further elaborate on that, right? That's why I believe Dr. Ian and I can share the we shake our heads every time when doctors say, "Oh, you got back pain, you should rest."
And
I
make any
think
sense.
yeah, it's horrible. So we want to make sure that the patient move and have the confidence to move, not bound by the pain itself. Like you said, atrophy is one of them. The muscle will not be strong. So at the
Right.
end of the day, when the patient asks like, when can I go back to the sport, right?
Mm-hmm.
But our normal consensus is whether they have recovered completely or made a close to full recovery first,
Close
and
to
the
full
second one is whether
recovery.
we can reduce the injury risk. If that risk is not dealt with, right, I don't think it would be wise for the patient to go re-injure themselves again. Mm, if it's this is just for general knowledge. If it's a strain, it heals faster than a sprain. Strain is
Yes.
for muscles and sprain is for ligaments. It's the nature of ligament doesn't have much blood supply. So you might take a bit longer in terms of icing and rehabbing a bit longer than compared to strain, because muscle has a lot of blood supply.
Mm-hmm.
So yeah, that would be my answer for that question.
Yeah, so it
Right.
goes without saying that we both do provide some sort of therapeutic exercises that complements whatever injuries that you have, or if you're training for your performance, we can include this as part of like an injury prevention program. So speaking of injury prevention, or rather risk reduction, we have our second benefit, which is improved recovery and reduction of injury risk. As said in the ankle injury example just now, we can help those who had multiple sprain strains, repeated injuries, and help reduce the injury risk and shorten the recovery time so that the athlete can return to play ASAP, right? The third benefit is reduced pharmacological intervention. I said that right, yes. All we know, as we all know, right? All drugs have side effects, right? Sometimes the pain of the athlete experiences during the training or competition can lead to a significant amount of pain, which sometimes lead to the athlete using painkillers or NSAIDs to sustain themselves. The most common one we all know lah, which is Panadol, right? And anti-inflammatories that are used to relieve these pains or aches. right? This can lead to some sort of a risk of dependence or addiction to these drugs that is not a pleasant state to be in. Just for some backing of some of the things that I'm trying to say, recent 2020 systemic review and meta-analysis published in the Journal of Pain Medicine showed that there was an inverse association between those who use chiropractic care and opioid use, consider right, and discovered that people who received chiropractic care were less likely to need an opioid prescription for pain. You don't want to be dependent on these drugs, so you can stay off them. So I'd like to pass the mic to Dr. Sam to elaborate further on the third benefit. So take it away, Dr. Sam.
Yep, I think reducing the use of drugs regarding about treating the pain, right? It's a very close topic towards pain management, as all chiros are experts in this in reducing pain without using any form of medicine or surgery. Let's talk about that. Let's talk about pain management in the next slide. As a chiro, we're pretty good at helping our patient to represent their body, something like an attorney, and tell them what's wrong or why they're having the pain. And remember, there is no such thing as a normal pain, right? It comes and goes, something's wrong. Masking the pain with pain medication is something that is very powerful because, especially for athletes rather than patients, athletes tend to have a bigger incentive to reduce their pain because they favor performance over pain or performance over anything else. So the opioid use is actually quite scary in terms of that. And why people use it? Because it works. It targets the brain, it shuts down the pain receptors, and that's the problem. But the thing is, the pain is not in the brain. The pain is telling you at the ankle, for example, there's an injury or sprain or strain. It's trying to convey that message. So as sport chiros or as chiros, we tend to represent that and say that, hey, something's wrong here. So in a recent case study that I have, right, which I'd like to share, it's a 9-year-old ballerina that had came in with chronic heel pain, which she had it for like 2 years. She went through different specialists and she came up with X-rays showing that heel spurs, and at the end of the day, it landed on plantar fasciitis. The thing is, we again remember as sport chiros, we want to see the patient or the athlete as a whole. So after asking a lot of questions, getting a proper detailed history, and determining what had happened, right, is basically that her calves is just way too tight, and she needed an adjustment to the spine. And lo and behold, she got better. Now we can we can just clap our hands and say fantastic, and we just let life be. But the thing is, we went through the extra effort to actually go through a blood test with her, and it found out that the vitamin D in her bloodstream is in the toilet. Like, it's really bad. So at the end of the day, we tell the parent like, hey, your child's developing, you gotta expose her to a bit more sunlight, because they're always training from like morning to night in the gymnasium. Uh, Rarely expose them to any sun, especially during COVID. They're not going out anyways. So yes, and through that she sleeps better. She Oh yeah, I didn't say she was addicted to opioids actually, and that's why she came to a chiro to came to me into my office.
Yes.
And yeah, especially for kids, you want to start them young and have pain avoidance behavior. That's not good, especially they start depending on drugs.
Mhm.
Yeah, so as an athlete, we gotta take care of them. So
Yeah.
on slide 12, we want to know that, are they being pressured to perform as an athlete? Do they have any sinister condition regarding about like a concussion to the head? How is their vitamin D or any nutrition they are missing out, so they can't do a proper recovery? Do they understand how to assess their risk in terms of the injury whatever they're performing? So such as if they're going through a contact sport, for example, like uh, uh, American rugby, American football, rugby. You want to look into concussion, and you want to invest proper protective equipment, which we'll talk about it very shortly. Know the signs of overtraining. This is very important, and especially we want to take a look at the mental health as well. Make sure they're in the right mind space. So yeah, so remember, kids and adults and everyone, prevention is always better than cure. And
Yes,
the
yes,
next
yes.
better opinion is actually get a good sport chiro in your
Yes,
speed
yes.
dial.
But
So
by the
if
way,
anything,
guys,
yeah.
sidetrack a little bit. Sunlight exposure does wonders for those of you who are suffering with sleep disorders. For example, if you're not able to shut your brains down when it's time to sleep, you probably need some sunlight in the morning. Yep. So
Agree.
yeah, I have a case to share as well. It's regarding the pain management section. So I have one patient who's a futsal athlete who's recently been diagnosed with fibromyalgia. So if you're a chiropractor and you're thinking, yes, fibromyalgia, yep, fibromyalgia. So for some of you tuning in today, fibromyalgia is pain all over the body, and with that you have things like disturbed sleep, fatigue, or even inability to think clearly. The type of pain is so painful that he must do something about it, else he cannot function to his day-to-day life. Right? It's so painful he can't even sleep. So it wasn't a straightforward case, as there wasn't it's a diagnosis of exclusion, meaning the patient was screened for many other things before arriving at the current diagnosis. We had many weeks or even months in between before even arriving at the current diagnosis, which is fibromyalgia. We started off with the usual treatment, which is adjustments, rehab exercises, breathing techniques, training load management, supplements, sunlight, vitamin D. But the max he can tahan is only 2 weeks. So he can sustain himself for only 2 weeks. So, and one fine day, about 3 months ago, we found out that it's fibromyalgia. So, long story short, in conclusion, not all athletes can be treated the same way. This particular athlete will have to be managed long term, as there's not really a cure for fibromyalgia, and of course, co-treated with other healthcare providers, right?
I think that is also very, very important for people who are taking care of you. If you have pain, if you happen to have someone who is taking care of your pain, it is actually very, very important to find out what's the real cause of it, instead of just blindly doing what you already know what to do. And if it's not happening, you might want to investigate further on why is it not improving, or what kind of issue are you actually having, rather than blindly doing something that you are not even sure.
Yeah,
Mm-hmm.
agree.
Mm-hmm. Yeah, all right. So we will move on. Some proper techniques and form of your sport, which is very important for the people who are playing like badminton, playing running, including like some are basketball and things like that. Those are like the common sports that we see around Malaysia. So, anyways, also before we move on, remember to tag your friends who will find this webinar useful. And yeah, take it away, Dr. Sam and Dr. Ian.
Right. I think when it comes to a specific sport, right, we have to talk about specificity, and especially regarding about whether they are doing what they're doing before and what they're doing after the exercise or the sport itself. Are
Sorry,
they warming
sorry,
up? Are they cooling down?
sorry,
Go,
Dr. Sam.
go ahead.
Sorry to stop you. We have one question on the fibromyalgia just now.
Okay.
How would you change your treatment plan for fibromyalgia, to Dr. Ian?
Well, that question is a bit hard to answer because I can't really change much. The condition doesn't really change much. It's a long-term thing, and depending on how often that patient gets a flare-up, then we just have to manage the flare-up. We did whatever we can with the supplements, with the training, the load management, the sleep, the water intake, everything we could possibly think about, the stress management as well. We're co-treating it with other healthcare providers. This is the best we can do for this kind of uh, condition. Of course, if drugs are necessary, we go ahead if it really interrupts with his sleep. But I wouldn't really change much with the treatment plan that we're on right now.
It's more on like how do you manage it with
Manage it, yeah.
manage it with the
There's
other
no
person.
cure for it unless we can manage
Mm-hmm,
the brain activity.
Pain
mm-hmm.
science is a really, really new, I would say,
Yes.
relatively new subject. So it's good to have different
Mhm.
aspects and different points of view.
Yes.
Having a Cairo at the building or in the board, right, would definitely help in treating it conservatively rather than going super invasive in the moment.
Oh yes, yes,
Of
100%.
course, yeah. So we want to be conservative yet effective rather than just treat the symptoms. That would be very important. I think Dr. Ian can't really dive deep also regarding about the cases because that we want to protect the patient's information as well. Because fibromyalgia might not be a physical problem. It might be something related to something a bit more, we will say yellow flag, something a bit more about family, something a bit more on the relationship. Because pain, like I said, pain sciences is really difficult to pinpoint.
Yeah,
So
it's really
it's tough.
complex.
It's very complex. We're not just saying for the sake of like, oh, brain complex and full stop.
It's really, really complex.
There's many pathways that generate pain. Until today, we're still kind of struggling to fully understand and grasp pain. Some people feel pain for a short while. Some people have high pain tolerance, low pain tolerance. So for fibromyalgia, you can actually just put it as the guy has a really low pain tolerance at specific points of time,
Yeah, you can put it
and
away,
yeah, you
seriously.
can put it that way. But again, the more perspective you have, proper, educated, what evidence-based treatments and healthcare professionals can help with this kind of cases. We need that rather than just one like a surgery or because go something super invasive. You know what I mean?
Yeah, I hope that
Mhm.
answers your question.
Yeah.
Whoever will ask the question, right? So we're moving on to slide 15, is it?
Yeah, proper technique.
Oh, from technical.
Mhm.
Yeah, Dr. Sam, please take it
Go back
away.
to Dr. Sang.
So should you become like one punch man and do like 100 push up, yeah, with a poor form, or like 10 proper push up every morning, and you just carry that forward for the rest of your life? Again, progression is super important. You want to talk about specificity of an exercise. Of course, there's always no size fits all. Whatever that guy go through in a nice body, maybe he has good genetics, and then he develops that muscle with little or no nutrition. That's him, but we're gonna talk about you. So it is tailor made to your need, to your. We don't want to say the word disability, but we have athletes who don't have a leg or went through a big trauma and they are trying to get back in life through sports and want to give them the best edge they have to actually succeed in life and succeed in what they're doing. So it has to be specific. So
Yeah.
you shouldn't compare with the people beside you or say that that guy is the same age as me or younger than me and he has like ripped six pack. That's not the goal. The goal is to compare with yourself. And as a sport chiro, we will walk with you and we'll put landmarks with you and say that hey, you've been through that. And after literally, I believe Dr. Ian can share this experience as well. Is that
Yes, yes,
so
yes.
6 months
So,
later, they see how far you've come, then they're really proud of themselves. So yes,
yeah, no,
specific exercises. It's very important.
yeah, wait. So sometimes, right, you might be tempted to do a lot of exercises to correct your issues. Whereas if you were to engage with either Dr. Sam or any other healthcare provider, who's qualified healthcare provider, you probably need just like one or two exercises to improve your overall performance. This is what we're
To
trained to
begin
do, and
with, to
yeah,
begin
this is what
with,
we're trained to do.
anyways.
So, and this is how we can simplify things. To put it this way, if you're someone who sits a lot, you probably have someone who sits a lot kind of issue, right? If you're a student, you probably have students kind of pain, right? Uh, Sitting long hours, headache from trying to burn your midnight oil to finish up your assignments, that kind of thing, right? So if you're an athlete, or for example, if you're a footballer, you most likely have footballers issues. If you enjoy running, there's a chance of you getting runners issues. Point is, yeah, we even have names for some of these conditions according to the sport.
Yeah,
Runner's
you
knee,
run this knees. Yeah, there you go.
jumper's knee, tennis elbow, golfer's elbow, and so on, right?
Yeah.
So here's where we come in with our expertise and to advise our patients, as Dr. Sam advised the young ballerina about her sport and catered to her individually. So again, there's yeah, like Dr. Sam said, there's no one size fits all for this kind of thing. Yeah, pass it back to you, Dr. Simin.
All right, so we have like 1 to 2 questions on the footwear. So are there any advices on shoe wear and like proper footwear for runners who just started out?
Who just started out, meaning that there's no like no prior running experience or
Yeah, probably. I think I'm assuming is that just started out, meaning that they don't have much info on what kind of shoes that they are supposed to wear, or what kind of footwear they're supposed to wear. So they use like maybe random shoes in their house. Like that happens to me too. I used to use random shoes to run.
well, you don't have to. You don't have to break a bank to actually get a good shoe. Actually, Skechers is one of them. You want a shoe that actually hugs your ankle, if you know what I mean, because it supports the ankle a bit better. Yeah, literally just hugs the ankle, prevent it from actually kind of like go inversion and eversion sprain. But for just want to specify, if the person has never run before and they want to try it out, I think I can hear Dr. Ian screaming in his back of his head saying, "You should walk first. You should walk first. Don't run. You should walk first." So
Walk first,
every
chill, yeah, chill,
yeah,
walk.
just don't run. If you're inspired, you're more highly motivated because you have like idol that you're picking up during the MCO. And you're like, I want to do some pounds and I want to, uh, gain some muscle. Running running is a good sport, I would say, but definitely you have to do proper warm up, build up to a point where you count into your kilometers and your pacing. There are good apps like the Nike app for runners. They'll look into that. Measure, get a journal. It's always good to look at progression so you can know that you're actually improving yourself. Um, but yes, definitely work with a sport chiro. That's the default answer. But if you can get a shoe and you can afford it, I highly recommend Boost from Adidas. I'm sorry, this is not a endorsement, but I just find personally that the Ultra Boost is just amazing.
Not
For
sponsored.
not sponsored, but yeah, look into that because the fact is that it has everything. It cushions the heels properly. It hugs the ankles. It shapes the feet of my shape of my feet. Sorry,
Shit, the
kind
boot
of
feels nice.
caters to that kind of cutting. So it really depends on how you feel. So yeah, that I would say, Dr. Ian, you got anything
Well,
for?
I think if we're just talking about like normal sports, not sports specific ones like I don't know American football or something like that. We're talking about like running, jogging,
Hiking,
hiking, that kind of thing. Then just get
Malaysian
something that,
favorites.
yeah,
Penang
then just get
favorite, no, Penang
something that,
Hill, good board.
yeah, very important is your toe box. The eight the four the 4 foot of your shoe, the toe area. Just make sure that it's big enough for your toes and it's not like triangulated and like narrowed down. Even though it looks ugly, but it's probably better for your toes. And you don't get something called bunions. If you were to Google it,
Mm.
then you probably see that your parents would have them.
Might have it,
I just
but
wanted to say my mom has them.
Yeah, so get something with a wide toe box that allows your allows your
toes to
shoes, like
wiggle.
allow your toes to breathe, not your
Yeah,
shoes, allow your toes to breathe. All right,
that wiggle
just
room is
Yeah.
super important. Yeah, for sure. I agree 100%. There's another rule, not rule. There's another thing you can look at into other than just having wiggle room, is to make sure that your shoes are not too wide. If you know what I mean. The length. I'm not talking about length. I'm talking about the width. Width. If it's too wide, right, we always obsessed with the curve on the side of the feet, but we always forget there's another arch in the middle. And if the shoe
terrible.
is too wide, the curve actually flattens out. So that's an issue as well.
Mm.
You don't want it to be
Mm.
like, again, too snug or anything, but you want it to be supportive. That's for sure. If the athlete is very concerned about their flat foot, whether they really have an anatomical flat foot, this one you have to do some. This is a very easy test. We want to talk about orthotics, whether it helps or not. Consult your sport chiro, consult your chiropractor to actually see whether or not you need a certain orthotics. Because orthotics is basically the support that comes underneath your feet. It comes in various shapes and sizes. You want to make sure that it's the shape and the size that actually fits you the most. For running, there are rigid ones, there are soft ones, many kinds. So you have to see what are you doing with it, and whether it's suitable for your feet. So again, if it's typical running, it's fine. But I like to add also, if you're going hiking, get some hiking boots. Don't wear
Yeah,
some walking shoes and hike. If you're running on fields, please get some cleats. Don't you dare walk rows, sprint and cut on grass and you slip and fell and you sprain yourself.
yeah,
This is
man.
very common. And
Or
it
your shoe will
happens.
fly away.
Oh yes,
I
two-way
think the
touch.
most important thing is also if you ever had like injuries in your ankles and your knees, and you don't, like I said, if you don't feel like your foot or your leg is grounded, or you feel like it's walking on air and you're going to fall any moment, please consult us or consult someone. and figure it out, because that's not how you're supposed to be walking in the first place. If you have that kind of proprioceptive deficit, or what we call a balance deficit, wearing whatever kind of shoe would help a little bit, but you still feel really unstable when you walk.
You'll be
So,
surprised. Just an adjustment can make a whole lot of difference. Actually, that's
oh
what I would
yes,
like to say.
100%, definitely. Right. So,
All right.
Mhm. Yep, we'll
right.
move on. Nutrition and sleep.
All right. So we did talk about vitamin D. It helps with sleep. It helps with bone productivity and recovery. But you have to look at magnesium as well, whether there's enough protein for muscle recovery. So yeah, this of course as chiros, we don't really are an expert in this field. We are dietitian nutritionists as well. That's why we work very closely, and I have the opportunity to, and the basically, I'm very fortunate to work very closely with some hospitals dietitian to actually work with them and make sure that the patient's going through proper recovery. Um, yeah, don't forget magnesium. Don't forget about your protein intake. This is very crucial. Omega 3 as well for the inflammation part. So the goal is simple for the treatment and for taking care of as an athlete. You shouldn't be experiencing pain, just like you shouldn't hear like, oh, my car has a sound. That's normal. That's not normal, my friend. You have to actually go and see a mechanic to sort out the car before that sound turns into a noise, and the noise turns into a fire. So it's the same as the body, just that the body doesn't have spare part. Your car has spare parts. So have a look at that. Knowing that athletes normally don't come in with pain, we want it to be performance driven as well, but not at the expense of the athletes' welfare. And most importantly, we want to put their career first. They can go fast, but if it's a car on fire fast, it's not a good idea. You won't go far. So it must be a long, enjoyable athletic career. And that's why we're
Yeah,
here, right, Dr. Ian?
Yes,
yeah.
100%. Yes. So,
I think we should also say that you shouldn't be experiencing abnormal pain as an athlete. It doesn't mean that you need to be an athlete to experience abnormal pain. I mean, like, you don't need to be an athlete to have pain that is abnormal.
I agree. There's no such
okay,
thing
let
as
me
more
just
pay, more gain.
Yeah, I
Again,
think a
that
lot of
used to be a
people,
motto.
no pain, no gain. They will feel like pain is necessary for improvement, but sometimes it's the wrong pain you're looking for. Yeah. So I guess
uh,
we all have to take note of that. Especially now, it's like MCO, right? We just
Yeah,
started to like opening up. Recently, they just announced
gyms are
cross
open.
states.
Oh yes.
Gyms are
I've
open,
got
cross
another
states.
point to put. If
Go
Mm-hmm.
ahead.
you are just starting out and you're experiencing a little bit of pain and discomfort, I think that's still, to some extent, that's
Normal.
still okay. But if it's longer than, let's say, 2 weeks, and you're still having that kind of pain, then it shouldn't. You should look for someone. Like, you should look for
And the
someone.
type
Look
of
for
pain
sport chiro.
matters also.
Yeah, that's
It,
true.
but to say that to have pain entirely, like to go entirely pain free, so it cannot doesn't quite make any sense. Cause to live is to have a little bit of pain. But to have that little how do I put this?
To what
Abnormal pain
extent
is
it is
actually okay.
normal.
I think
Yeah, a little bit of pain is
for
okay. It's almost like catching a cold, right? If you catch a cold, we can't say that you won't ever not catch a cold ever again, right? But is how your body is able to adapt to that cold, right? So with
Mm-hmm.
regards to your pain as well, having a little bit of pain is okay when you're first starting out to jogging, running, for example, but you should be able to adapt to it, and it shouldn't cause you abnormal pain. Sorry, it's a bit vague, hard to explain, but
I'll try
Mm-hmm.
to actually further elaborate on that. There is
oh yes,
there
please,
is a
understand.
this disorder for people who just started running. This just hit me.
Mm.
I don't know why I didn't bring this up, but for the person who just typed out and said that I want to run, right? Beware of one condition called splint shin, because the fact is that if your muscle gets
Shin,
too
Shin
shin
splint.
splints, sorry,
shin
Shin
splints.
shin
splint.
splints, say that 10 times, yeah. Shin splints. What happens is that the muscle tends to outgrow the connective tissue around it, and you develop a very uncomfortable burning slash stretchingness in the shin part of your feet. That's something that is due to yeah, it's basically the muscles growing out too fast and too swollen at the same time. So you need to manage that. And again, if the athlete actually does, more than just running, say they go into mobility, they look into things that is that accommodates with the muscle growth, right? They will normally don't feel that much pain. And I think pain, again, there are many types of pain, but we should look into the word discomfort. It is required for someone to do something, right? And it is something that normally that improves the person. For example, getting up early, do 10 push-ups, right? It's uncomfortable. You rather stay in bed and feel comfortable. But if it develops into a habit and the body can adapt to it, like a cold, for example, your immune system kicks in and you're fine, you generally be fine. And normally it'll take 2-3 days. It shouldn't take more than that. If you feel pain, like Dr. Ian said, more than 2 weeks, I personally generally feel that that's a bit too long. If it's like 3-4 days, heck, I even have athletes coming in without pain but saying that I feel off, right? I feel like for example, my legs are not even, or I feel that it feels weird, right? They can't put a finger on it. Or people who have really high pain tolerance, they won't say pain, they'll just say that it feels iffy. So we need to, like I said, as an attorney, we need to represent their body to and explain to them, medical terms and whatnot, but to make sure they understand it. And as a detective, we need to look into what's causing the pain and how can we treat it. So yes, I agree with you on the discomfort bit, but pain should never be, out of hand. There's no such thing as
Oh yeah,
normal pain,
that,
I'd say.
yeah, should
All
manage
right.
it.
More Q&A.
Okay,
Bring it.
we are done. I think we are looking for any questions that anyone still has. Just drop in the comments below so we can try our best to answer them. We will allow probably around 3 to 5 minutes. But I think we already answer it along the way just now.
Yeah,
Yes, we did.
we did.
Yeah, I think also adding on to just now what you said, right? A lot of people, I see the trend of people building muscles and not looking into other aspects of the body, maybe like mobility, like what you said. Yeah, that also causes a lot of pain somehow. Mhm.
Right. I would
It's a
say,
it's yeah, it's
yeah,
a very whole well-rounded thing that needs to be taken care of, not just the muscles, which we always think that it's only the muscles.
I think weightlifters or powerlifters can agree on this part that you look nice in front by building the abs, the pecs, and all the pushing muscle. But there's a saying that goes, the longevity of your lifting career depends on the back muscle, right? The stronger your
Mm.
back muscles are, or the posterior chain, the longer your career in your lifting weights in your life. So you have to take a look at the pulling muscles. A lot of our exercises at home, right, is mostly on pushers. So we gotta invest into a pull-up bar or something, right? If you want to build muscle, make sure it's evenly built, not just at the forward part. Look at the back. Uh,
Yeah.
there are many aspects of fitness as
Both.
well. You just don't want to look
Invisible
swole
syndrome.
and yeah, you can't touch your back. That's silly. So you want to be flexible enough to not be restrictive when it comes to fitness. There's some form of healthy mobility, and I believe Dr. Ian is definitely going to be very adamant on after exercises in terms of the pumping up your chest, your back, your lats, and everything. Make sure you finish off with yoga, right?
Oh yes,
It's
yoga for
not.
life, guys.
Oh yeah, right. I
Simple
actually
stretches will do also.
no, but yoga is next level. You're talking about breathing, mindfulness, you know, getting
Okay.
all, yeah.
We actually have one question coming in
All
from
right.
Pauline Low. Does the thickness of the sole of the sport shoes matter for sports performance? As we sometimes see very, 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 very thick soles for sports shoes in the market.
Dr. Ian. Do you need time, or I'll
Does
just go?
it matter,
Yeah, Dr.
like
Sam.
we know that we need a support, but do we need something
To a
so
point where
thick?
it's so thick. Yeah.
Mm,
I will try to chime in by saying there are many types of shoe being made, and we can definitely look into the Jordans, like the basketball ones. If you look in the history, right, they have made pretty interesting invention of shoes. Instead of making it thicker, right, they start adding a pump, like an Air Jordan pump, and there's like an inlet for them to actually pump in more air. Um, is that helpful? The guy can basically bounce off his feet when he jumps, right? Which is what you want during a basketball game. However, his body is not used to that power and the speed and the momentum, so he ended up spraining or straining himself. I know it because it's from previous case I had. Regarding about just soles and where would you use it is very important. If you're running on concrete, I would definitely say that I think typically a thicker sole will be better, a softer, thicker sole. But if you're running for, say, if you're a track and field person and you know that track is a bit bouncy, you don't need any more thicker soles, I would say. And to the other spectrum, not runners, but weightlifters, I think you don't want any thickness in your sole. You're going through
Just
canvas
go
because
barefoot.
yeah, because the fact is, well, if your feet is not strong or it's doing this kind of wobbly things because it's so thick
Yeah,
on your
this
sole, it
kind of
starts
thing,
doing
right?
this, you're putting weight on top. Last thing you want is that you're gonna sprain somewhere, whether it's low or high grade. But the sole matters in terms of the sport that the athlete's taking. I wouldn't say you should go and wear platform shoes and run on concrete. That's very silly. Uh, but there is a certain amount of thickness that you shouldn't go past. Let's just put it this way. Um, Another one is,
Okay,
this is out of
question.
topic, but I'll just add it
Mm.
anyway. For patients, I mean not athletes, for patients who have heel pain, I think it's definitely helpful if they have something a bit more thicker. Say a Crocs works wonders apparently. Um, but yeah, that's for the recovery phase. But for sports, find the one. Like I said, right equipment works wonders. All right, yeah.
Oh, next
thank
question.
you, Dr. Sam. So we have, I think we're taking in the last question. Will you recommend us to wear a knee brace when we go for hiking, like how weightlifters normally wear a lumbar brace when they are lifting weights?
Okay, so I'll take this one.
Cool.
Uh, Firstly, we gotta understand how the weightlifter is using that lumbar. Is it lumbar brace? More like a belt, right?
Belt.
Those
It's a belt.
belts, right?
Hmm.
Training belts, right? The way that they are using the belt, it's not for a support. It's for them to push against the belt, to push harder to lift heavier weight. If you are someone who has knee pain, for example, and you want to wear a brace, at least for the short term, just to manage with the pain, I think it's a good thing for the short term. But if you're young and you're athletic and your knee pain just doesn't go off, even if you don't wear that knee brace, then I suggest you better look for something else to do. Maybe strengthening up the quads or even the legs. This is where we should actually have sort of like a consult to figure out what's going on. Because the last thing you want to develop is something called a fear avoidance belief, meaning you don't dare to do that particular sport because you're having, like, for example, knee pain, or for example, if you can't live without the brace, right? You got to go everywhere with the brace. You got to go to the toilet with the brace, right? How you gonna live like that, right? So, Dr. Sam, got any input on this?
A quick one. Definitely agree with the powerlifting part because people think that they slap on something, they become stronger. That's not true. For the knee, right? If you look at the market, there's two types of braces. One has is just a fabric, I would say, and I really see a lot of old people love it, the geriatric people, and they say that I wore this and I feel fine. I don't feel the pain anymore. That's the part where you would say it's kind of an avoidance part because how pain works is that your knee, if it's mostly young people here, this is for your grandma and grandpas, They're wearing that because vibration sense overrides pain. That's how your body works. So having something over a painful site, right, and you keep rubbing it, you won't feel that pain. For example, if you bump into something, have you ever wondered why you just instinctively start rubbing it and say, "Oh, it hurts"? It's because that you're trying to block that sensation of pain to your brain, and you feel less pain. There are braces or for supportive purposes. People with
Mm-hmm.
OA, the clinic that I'm currently practicing, I work with three fantastic physios, and we do something called unloading bracing. I have prescribed those to a lot of elderly people who are experiencing, like, say, grade 3, grade 4, even grade
Oh, yeah.
2, at times as early as grade 2 OA, osteoarthritis of the knee. Um, we want them to actually graduate, meaning that Dr. Ian said, we don't want them to be dependent on it. So in the beginning, you want the joint to heal, you have to create a space. And then after that, they only use it when they go for kakai, when they go for, like,
Okay, yeah.
traveling and whatnot. Yeah, when they walk along with their family, let's say, and they want to keep up, they normally wear that without pain. Actually, that's where we want to get them. So brace for the knee if you're going up the heel, because for supportive purposes, the long term is definitely to work on it, like Dr. Ian said, not just slap on it and pray that you won't get
Yeah.
sprained.
I'm gonna add on a little bit and make you guys a little bit more confused right now and say that, you know, just now you mentioned something about like use it or lose it. The rules apply even if you have OA as well. But and remember the too fast too soon thing. But so you have to apply that rule as well. So if you have knee pain and you need a brace now, go ahead and have it because to manage the pain. But eventually you got to get off
Rid
of
of it.
it and start
Yeah.
to strengthen yourself slowly, right? So that you don't develop all this fear avoidance belief. Fear avoidance belief include things like uh, you don't dare to go out or you don't dare to do the things that you love, running, walking, yoga, whatever it is, right? So if you're not sure on where you are, kindly again consult someone, right? A health certified healthcare provider, right?
Especially a sport chiro, for sure. For
Oh yes,
this for
definitely.
this talk, yeah.
Thank you, Dr. Sam and Dr. Ian. I think that is all for our Q&A session. Yep, a bit of sports chiropractic, Dr. Sam.
I'll end it with this. Whoever who is a chiro and is interested in further specializing into a sport chiro, you are welcome to join for sure. Just DM us through this email and we'll sort you out. But the thing is, there are the benefit of joining is basically we'll invite you for events. We need help. We need a lot of manpower for different events. We would have workshops. We will have seminars to update you on regarding about concussion, which is basically the one that we're going to conduct very soon, like in the mid of November or mid of December. That's the next workshop for SCCM. It's about head injury and concussion. The next year, we'll try to bring in Q1 the FICS representative. They are the Federation of the International Sport Chiro Committee, and to actually go on with the hands-on practical test, so that we can finish our training as well, because we've done our theory as well. Whoever is interested, please DM or you contact us or through email, which is down there. And yeah, we'll hope to see
Yep.
you guys
Yep.
all
So
together.
before we end our session, right, I'd like to say that if you are looking for the best sports chiropractor in Malaysia, look no further than from the Sports Chiropractic Council of Malaysia (SCCM). Our chiropractors are experienced at providing specialized treatments that can help or improve the athletic performance for those who participate in badminton, golf, football, basketball, any ball, every sort of ball, right?
Yoga.
Yoga
Oh,
ball.
yeah, yoga involves some balls as well. But anyway,
Yeah.
sports chiropractor works with athletes to heal faster and improve stability, coordination, and overall performance. So I'm Dr. Ian, mobile chiropractor, and
I'm Dr. Sam from Tex Penang,
all right. So
and
see
Thank
and that's
you. Yep.
Dr. Zimin right there.
Yeah,
yes.
thank you, Dr. Ian and Dr. Samuel. Really like gain a lot of information, especially like when you both are my seniors. Like I always ask a lot of this kind of questions. Yeah. So if you're interested in sports chiropractic as a chiropractor, please do contact either Dr. Sam, go to their email, drop them an email, blah, 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 and things like that. And yeah, the next event we will have tomorrow is a Zumba class. You can go on our Facebook and check it out and sign yourself up if you are interested. And also we have 6 more days of webinars coming right up in conjunction with our World Spine Day. If you have any questions or any doubts, please do feel free to DM our page. Go to our Instagram, follow our Instagram, ACM Malaysia, Association of Chiropractic Malaysia. Search it on Instagram, on our social media. Yep, and drop us a DM and we will try our best to answer your question. And yes, see you guys. Good night. Have fun. Stay safe. Visit your nearest chiropractor soon. Thank you.
Thank
Bye.
you. Bye, everybody.
Bye.